The NHS right now is caught between two completely different worlds. On one hand, you have nurses on the front line working under these immense and frankly often unsafe pressures. But then at the policy level, there's this big push for yet another major structural reform. Now, this isn't about whether reform is a good or bad idea. It's about asking a much more urgent question. Is it actually safe to start rebuilding the house while the foundations are crumbling? So, on one side, you've got all the official promises. They're laid out in these formal policy papers with ambitious titles. And on the other side, well, you've got the harsh reality for staff and patients, a system stretched to its absolute limit, unsafe conditions, and even people being treated in hospital corridors. It's this huge gap between the promise and the reality that we really need to get our heads around. So, what does this pressure actually look like on the ground, day in and day out? Let's break down the real symptoms of this system-wide strain. And look, you have to understand, these aren't just separate, isolated problems. It's a chain reaction, one thing leading to the next. It often starts with what's called corridor care, treating patients in completely unsafe spaces. Why? Because of unsafe staffing levels, which are often driven by intense financial pressure. This, in turn, completely fragments a patient's journey through the system, breaking that vital continuity of care. And what happens when dedicated staff try to raise the alarm about all this? Well, too often, their concerns are either silenced or just get bogged down in a slow, ineffective response.
So why are these dangerous problems so persistent? Well, it all boils down to one core concept, the implementation gap.
Now, the crucial point here is that this isn't about bad intentions. It's not even about a lack of rules on paper. It's a fundamental failure of execution. The laws and the policies that are created way up at the top just aren't making it down to the ground in a way that creates safe, effective practice. It's like there's a broken link in the chain of command. And here's the most critical and maybe the most frustrating part of this whole story. The tools, the actual legal machinery to fix these problems, they already exist. Parliament has already put them in place. Let's get specific for a second. The Health and Care Act of 2022, it's right there. It gives the Secretary of State the power to direct NHS England, and it gives NHS England the power to step in and intervene with local health boards that are failing. So you see, the tools are there in black and white. The real question is, are they actually being used to protect patients and staff?
Okay, so if the powers are already there, what would a practical path to actually fixing this look like? Well, the good news is there's a really clear proposal on the table.
There's a practical, corrective route available right now, and it doesn't even require new laws. It's a governance tool, basically, called a Standardized Memorandum of Understanding, or an MOU. Think of it like a system-wide agreement that makes it crystal clear who is responsible for what, making sure those safety protections are enforced using the powers that, as we've said, already exist. So how would this MOU work in practice? Well, it sets up three really clear safety guardrails. First, you give frontline staff the authority to escalate problems the second safety limits are breached. No delays. Second, you establish a treat first, settle funding later rule. This stops patient care from being delayed by bureaucratic fights over who's picking up the bill. And third, if a hospital's financial reports don't match up with its safety data, you trigger an automatic external safety audit. You just can't be allowed to claim success when safety is at risk. But, and this is a big but, just as we can see a clear path to fix the problems we already have, a huge new risk is emerging. And that's the push for even more large-scale restructuring on what is, let's be honest, already very unstable ground. I mean, just listen to this. This is a stark assessment from an analysis of the government's plans. The worry is that throwing more massive change at a system that hasn't even fixed its current flaws is, to put it bluntly, irresponsible. And what's being proposed is another major layer of disruption. We're talking about abolishing NHS England, bringing in brand new system arrangements, and creating new delivery models. This is not a minor tweak. It is a fundamental shakeup of the whole thing. So why is this so incredibly risky? Well, it's because the system isn't starting from a place of strength. An official expert panel in Parliament has already looked at the government's progress on patient safety, and their verdict requires improvement. It's just common sense, right? You don't start building a new extension on a house that already needs major structural work. Just look at this timeline. You can literally see this cycle of constant organizational churn. In 2022, new powers were introduced. In 2023, major functions were transferred around.
And now, before anyone's had a real chance to properly assess the impact of those huge changes, another massive restructuring is on the table. This just risks creating more instability, not solving anything. So, with all that said, where do we go from here? The path forward, really, it has to be guided by one single core principle: delivery. Because for the nursing staff on the ground, this isn't some abstract policy debate. It's about whether their day-to-day reality, the desperate need for safe staffing, for unbroken care pathways, for a system that actually listens when they escalate a problem, will finally be treated as the top operational priority it is, or will it just be pushed aside by more financial pressure and organizational chaos? So it comes down to three very clear principles. The first step is simple. Before you introduce any new reforms, you have to prove you can effectively use the laws that are already on the books. In other words, delivery against law. Next, this means making the priority what it should have always been: protecting patients, protecting staff, and protecting the continuity of care. The principle has to be safety before restructuring. And finally, we have to fix the deep existing failures in the system before we go and add another layer of complexity and risk. The focus has to be on correction before expansion. So, the question we're left with is actually pretty simple, but it's incredibly powerful. The issue is not a lack of laws. The issue is whether the law that is already in force is being used to secure safe delivery in practice. That is the test.